Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Diploma Programs, Diploma in Critical Care Nursing, DCCN, BNS-031 Concepts and Principles in Critical Care Nursing, Block-1 Introduction to Critical Care Nursing, Unit 1 Concepts and Current Trends in Critical Care. 1.1 Objectives. After completing this unit, you will be able to times define the related terms, times explain the concepts, trends and scope of critical care nursing, times describe principles of critical care nursing, times discuss the phases of critical illness cycle, and times state the role of a nurse in the management of critically ill patient and helping the family to cope up with prevailing situation. 1.2 Definition and meaning of terms. While reading contents of this section, you would come across some terms used in this section. Meaning and definitions of the terms are given below. Times critical care nursing. Critical care nursing is a specialty area which deals with human responses to life-threatening situation problems. It focuses on the care of critically ill or unstable patients. Times critical care nurse. Critical care nurse is a licensed professional nurse who has undergone specialized and prescribed training program in critical care nursing successfully and is competent to provide optimal care to acutely ill and critically ill patients and their families. She coordinates and provides nursing interventions aimed at resolving life-threatening problems. Times critically ill patients. Critically ill patients are the patients who are at high risk for actual or potential life-threatening conditions or problems. You must remember that a critically ill patient is likely to be highly vulnerable, unstable with complex problems in presenting his/her health responses, and thereby requires intense, vigilant and constant nursing care to deal with the problems promptly and effectively. Appropriate nursing care of critically ill helps to prevent complications, restore stability and maintain optimal response. Times critical care unit. These are areas of providing intensive and immediate care to critically ill patients. Examples are medical surgical intensive care units, trauma and emergency units, coronary care units, etc. 1.3 Concept of critical care nursing. Critical care nursing concept is the theoretical view of critical illness and care. 1st March 2001 Focus on critical care nursing. It is an established fact that critical illness affects both patient and family from various angles, including effect on psychological, emotional and socio-economical aspects. Hence, the focus of critical care nursing should be on patients and their families. Let us begin with focus on patient, then talk about family. 1. Patient. Patients differ in biological capabilities in their response to insult injury in maintaining homeostasis. Critically ill patients are in a physiologically highly unstable state and are at high risk. They require special, intensive and continuous care. The focus of critical care nursing is influenced by increasing and updated body of knowledge about human system response to life-threatening illness episodes and the knowledge of actors, variables, that will improve or worsen the recovery. For example, increased stress impedes recovery, but its reduction through holistic care would hasten the recovery from illness. You might have noticed that patient in critical phase is unstable and unable to communicate effectively. They are under severe stress due to physiological activation to counteract the insult or injury he has suffered, which causes changes in patient's vital parameters and behavior, etc. You can observe them through continuous monitoring of physiological parameters, changes in general condition and laboratory testing. The focus of your care as critical care nurse to reduce the stress will be evidence-based, directed towards the patient problems or needs. You may recall that patients in intensive care units and those who stay longer in the hospital are likely to develop some kind of thought pattern disturbances, e.g., delusion, hallucination, illusion, etc. They require holistic care to help them to accept reality, adjust to stress and gain possible independent functioning. After the critical phase, you can encourage patient to express fear, anxiety and worry about his/her sickness, medical and nursing interventions, and future plan for preparing them for the discharge. The way patient views his/her sickness usually will depend upon various factors, e.g., type and the extent of the effect of illness, experience with previous hospitalization, place and role in the family, community and the expectation to reintegrate in them. Your earlier knowledge of social dynamics that are unique to each patient will help you to identify required resources within the patient, family, hospital and community while planning for rehabilitation and discharge. 2. Family. You should always consider family as main source of information and support to critically ill patient. Family is an important source of information about patient illness status, its predisposing or precipitating factors, and capabilities of the family in supporting providing care during crisis and rehabilitation. Therefore, you must establish trusting interpersonal relationship, IPR, and an open line of communication for mutual sharing of relevant information. Family is a basic and nurturing unit for patient in regaining self-confidence, self-image which he has lost due to illness. Family members help the patients to communicate so that the patients can express their fear, anxiety, frustration, joy, excitement and contentment. You should assure and appreciate family about fulfilling its roles, e.g., biological, psychological, emotional and social functioning, as they will continue to influence the patient's recovery process. 1st March 2002, Critical Care Nursing Indicators. Critical care nursing indicators are grouped in 3 areas. 1. Direct patient care areas. 2. Intrinsically risk care areas. 3. Complex and new procedure areas. Let us discuss each indicators as follows. 1. Direct patient care area. This is an area within critical care nursing unit, where you as critical care nurse will identify and develop high priority indicators for direct care to individual patient given at frequent specified intervals. Otherwise the patient care will be drastically affected, e.g., in the routine admission, discharge, patient teaching, and administration of nursing and medical therapies. 2. Intrinsically risk care areas. This is an area which involves physiobiological functioning of the patient and is the main focus of nursing and medical interventions. You would have also observed in clinical area that even with correct performance there may be chances of adverse effects. There may be certain care tasks that may also make it hazardous. For example, blood transfusion involves many activities in the process of transfusion. Error at any stage of performing the procedure may lead to harmful effects on the patient or death. Therefore, you must be clear about the indication and contraindication or the intrinsically risk areas in clinical therapies. These procedures must be identified and necessary precaution may be taken. 3. Complex and new procedures. You would have also noticed imaging changes in procedures in the area of critical care. Complex and newer procedures are coming up with the advancement in medical technology, e.g., devices used for long-term support, new therapeutic procedures. Monitoring and care of the devices are the high-risk indicators because of their limited performance for establishing the care reliability. Those areas can be good for research which you can consider for your project. 1st March 2003, Phases of Critical Care Dullness Cycle. You should also remember that a critical illness is not a linear continuum but a cyclic process which represents series of changes in patient's physiological and psychological state of health which can result in development of critical illness at any cyclic phase. E.g., intermediate convalescent and rehabilitation, or even if patient has gone home he may become suddenly ill and the cycle gets repeated as per the illness status. The phases of critical illness cycle will include onset, resuscitative, intermediate convalescence and rehabilitative phase as given in Fig 1.1. Figure 1.1, Phases of Critical Illness Cycle. Look at the screen. Cyclic phases of critical illness. At all phases of the critical illnesses patient family requires continuous and compassionate nursing care from a competent critical care nurse. These patients may also require various treatment modalities which may include following: times active resuscitation, times massive blood transfusion, times heavy and large wound dressing or packing, times cardiac, respiratory, renal support, etc. However, whatever may be the cause, The critical illness leaves long-term effects that may require drastic changes in lifestyle of patients or may suffer relapse or loss of life and leads to a socio-economic burden on the patient and the family.
You would have observed individual differences in patient response to illness, circumstances leading to its occurrence and the subsequent care each patient require. Therefore, it is important to ascertain following information from the patient/family/others to understand the cyclic phase and to plan necessary interventions. Time/cycle of illness. Assess what happened to a person when he fell suddenly sick and its duration. Circumstances. Ascertain situation prior to illness, whether it is predisposed or precipitated in any way. Biochemical and biomedical changes. Identify what changes occurred in person at the time he became critically ill. Nature intent of the injuries. Document the type of interventions provided which will be required at different phases of the illness cycle. 1.3.4 Cost effectiveness of critical care. You might have noticed that critically ill patients are less in number than the patients with general sickness, but they utilize most expensive care facilities, e.g., high technology and specialized care facilities. Use of life-saving equipments and the IOCJ rehabilitation process involve considerable expenses. People who do not have medical insurance or belong to low-income group may not be in a position to get treated in good healthcare facilities. Sometimes they are overstressed due to financial constraints. However, expensive efforts involved in critical care do have visible humanitarian benefits. Most of the patients who receive timely and effective care return to society as productive workforce. Critical illness in many instances is sudden or as a result of neglect, complication of a disease, involving mostly younger generation of the society in which it has considerably invested in their bringing up, health, education and employment. Losing them in productive age leads to the economic loss to society which is greater than the hospital cost in providing necessary specialized care facilities. Therefore, the cost-effectiveness of critical care must be balanced against multi-sided benefits it has in life-saving and restoring the person to productivity. The government is now realizing the need for expansion of acute and intensive care facilities not only in hospitals but at the site of illness occurrence. Nurses, doctors and other staff are trained to deal with emergencies and the patients admitted in specialized centers e.g., trauma, critical care units etc. Ambulances -4 are equipped with medical staff, equipments and material to treat and transport critically ill patients safely to the hospital. Exercise 1. Observe/interact with 5 patients and their family members and find out the individual differences in communicating their needs, problem, expressing fear, anxiety. Exercise IT. Write down the existing procedures for admission and discharge observed in ICU/CCU and suggest addition and deletion in these in view of critical illness. Exercise 3. Write the cyclic phases of 3 patients with critical illnesses admitted in the unit, ward, referring to time/cycle, circumstances and biomedical and biochemical changes. Exercise 4. Gather the following information about the patients from your practical area treated for acute and life-threatening illness in a month. Compile and comment about the cost-effectiveness of critical care, name, age, diagnosis, outcome, status in family days in hospital. You are listening to this audiobook on Audio Learning IGNOU. 1.4 Current trends in critical care. Nursing. Trends in critical care nursing are impacted by its evolution, advancement in medical sciences, technology, and expansion from traditional nursing. 1.4.1 Evolution of critical care nursing. You are already aware that critically ill patients were always there and they did get special attention by keeping them close to the nursing station. This generally gave rise to development of specialized and super-specialized services through intensive care units, emergency department etc. Evolution of critical care nursing can be traced back to Florence Nightingale era, 1854. During that period, Florence Nightingale recognized the need for considering the severity of illness in bed allocation of patients and placed the critical ill patients near the nurse_station and developed a system of reducing death due to infection while nursing the injured soldiers of Crimean War at Scutari. In 1923, a special care unit for neurosurgical patients was developed in Johns Hopkins University. World over Red Cross services were developed to render first aid in disaster situations, floods, war etc. EVAs in 1950 in USA, that first intensive care unit, ICU, was developed and in India in early 60s. Now you can see, these units have increased manifolds as per the super specialty areas e.g., ICU, CCU, respiratory units, disaster units, resuscitation units, dialysis units, trauma centers etc. These have been helpful in saving life and monitoring patients closely. However, over the years it was realized that critical care required composite skills and holistic approach to deal with the patients and the family irrespective of the nature of the sickness. Medical and nursing personnel were trained to deal with emergency situations mainly with short-term topic-based courses on changing lifestyles, environment degradation which gave rise to many life-threatening diseases that required expert care on continuous basis throughout its phases of illness cycle. This required formal prescribed specialized training. The Government of India in its National Health Policy, NHP, 2002 focused on the preventive, curative and palliative aspect of healthcare and recognized the need for developing necessary manpower. The Indian Nursing Council, INC, took initiative to develop training courses for specialization in critical care nursing. Its first post-basic diploma in critical care nursing commenced in 2006. The critical care system has emerged as life-saving and it is one of the public health priority. Nurses are the indispensable force of the system, hence they require to be trained as critical care nurses. Modern approach to critical care is focused on efficiency in dealing with acute and emergency health situations. During 1960s, the care of a seriously injured or a sick person developed as system approach which gave rise to establishment of the Emergency Medical Services, EMS. In USA it was established in 1973. In India these services are gradually established as trauma centers, disaster centers, emergency ambulance system, and the specialized/super specialized units. Departments and hospitals are emerging in response to increasing demand for providing critical care. The essence of EMS is to provide immediate and appropriate care at the scene of accident or event, safe transportation to relevant healthcare setting for definite medical/surgical and the nursing management through the phases of critical care cycle. Critically ill person and the family require continued holistic care through expert nursing which form the basis for training. Competent and compassionate direct care providers. Effective member of the critical care team. Efficient nursing team leader, supervisor and manager. Proficient teacher to nurses, allied professional, staff, patient/family and others. 1.4.2 Influence of advancement in medical science and healthcare technology in critical care. You might have observed during your practice that the management of critically ill patients is undergoing drastic changes because of the emerging advancement in medical science and healthcare technology. These have been useful in the management of life-threatening situation, minimizing complication, early recovery, and return to possible productive life. Some of the examples of the advanced technology include following: innovative diagnostic tools, CT scan, MRI, angiography, etc. Use of these have greater efficiency in clinical evaluation. Blood gas analysis equipments, volume cycled ventilators with versatile control system. Positive and expiratory pressure, PEEP, used as therapeutic measure to control impending respiratory failure. Details of these You will learn along with related critical illness conditions. The advancement in critical care management system provides unique challenge to nurses in providing proficient care. As critical care nurse, you are expected to make complex decisions about patients' health status, which may include following: continuous physiological monitoring, interpreting results and taking appropriate intervention, assisting in instituting diagnostic procedures and therapeutic measures that may be appropriate to critical illness cycle. Critical care is a collaborative and coordinated effort of critical care team, nurses. Being in continuous contact with patient and family round the clock are in strategic position to facilitate the multidisciplinary team coordination apart from rendering care to patients and family. 1.4.3 Expansion of critical care nursing from traditional nursing. Critical care, as discussed earlier, is a specialty within e-nursing which has expanded from the traditional nursing and is a recent origin in the country. It has become more sophisticated and more demanding. In the United States, about 31% nurses seems to be caring for critically ill patient in ICUs, CCUs, transitional care or step-down units, emergency departments, post-operative recovery wards in hospital settings. In India, nurse-patient recommended ratio in these units/departments consume about 1:3 RD of the total nurses of the hospital. You have studied that nursing is an art and science which assists people in promotion of health, prevention of disease, curative care, rehabilitation and provide direct care to those who are not able to care for themselves. In doing so, the nursing combines art and science in utilizing scientific knowledge in a humanistic manner involving critical thinking skills with every caring behavior. You are already aware that nursing basically is a caring profession that requires maintaining a delicate balance and promoting client independence and dependence. The focus of nursing is on client response to illness than the illness. It is a behavior-based care unlike medicine, which is more of disease-based. The critical care nursing aims to give deeper emphasis into art and science of nursing combined with critical thinking that is necessary for understanding the depth of pathological changes the critically ill patient undergoes from the period of resuscitation through rehabilitation or dying and to institute appropriate nursing interventions. The critical care nurse supports client to move to a higher level of wellness and also assists the client with terminal illness by providing comfort, maintaining human dignity in his/her final stage of life and to a peaceful death. It supports the family concerns related to patient loss during grieving. To provide competent and dedicated nursing care through this program, you will be able to strengthen, update and develop necessary knowledge, skills and understanding of the critical care mechanism, team approach etc., which is required for delivering the effective and compassionate care through continuous monitoring, performing and assisting in diagnostic and treatment procedures, making complex decisions, instituting appropriate nursing interventions and encouraging early mobilization and appropriate rehabilitation to reduce disabilities and hasten the recovery. 1.5 Principles of Critical Care Nursing. Principles are the fundamental truth which you have learnt in your basic program in nursing. They form the basis for reasoning. Your quality of performance is linked with the strict adherence to these principles while rendering care. These are listed and explained below. 1. Efficacy, the degree to which the care and the nursing interventions have achieved the projected or desired patient outcomes. 2. Appropriateness. This indicates the degree to which the care and interventions rendered are relevant to patients' clinical needs. 3. Availability refers to degree to which appropriate care and intervention are available to meet patient and family needs. That is, critical care units are properly staffed and equipped. 4. Timeliness, the degree to which care and interventions are provided to patient, family. This requires your sufficient familiarity and keen observation of patient progress during different phases of the illness and promptness in diagnosis, deviations, and taking action. For example, patient who has cardiac arrest can lose life if cardiopulmonary resuscitation, CPR, is not performed within 5 minutes of the arrest. 5. Effectiveness, the degree to which the care and interventions are rendered in correct manner to achieve the desired or projected patient outcome. This refers to knowledge and skills of the nurse to make proper musing diagnosis of patient and skillful handling of machine/gadgets, administration of treatment therapies, carrying out diagnostic procedure, continuous monitoring, documenting, detecting deviations and taking necessary action. 6. Continuity. This emphasizes the degree to which the care and intervention for the client are coordinated among the critical care team and their collaborative management of the case. Your continuous and keen observation of the client's condition will help you to assess his progress and collaborate/coordinate with team members, departments, organization involved or likely to be involved in patient care. Good communication and IPR form the basis for effective team functioning and continuity of care. 7. Safety, the degree to which the risk of interruption in the care environment can be eliminated for patient and others including health cafe providers. It indicates that you should adhere to the protocol standards of the critical care, established and modified on the basis of research conducted or available in different aspects of safety e.g., physical care environment, therapies and procedure etc. 8. Efficiency depends upon the relationship between the outcome and resources used for the care e.g., competence levels of care providers, availability of required technology to save/treat patient, availability of needed equipments, supplies, drugs, appropriate communication channels and effective communication skills. In other words, a well-established critical care system that provides for collaborative, dedicated and compassionate care. 9. Respect and caring refers to degree to which the patient and family members are involved in decision-making of the care and its implementation. With sensitivity, you must listen attentively to client concerns and respect individual difference in their expression. As critical care nurse, your aim is to promote the quality of life than mere survival. This you can ensure by helping patient to gain control over his care through his or her gradual involvement in self-care decisions and care activities. 1.6 Scope of critical care nursing. With the increasing critical care services in the country and overseas, the scope for specialization and employment in critical care nursing is also widening. In USA, more than 2 million nurses with critical care skills are required. In India, training for critical care nursing specialization has commenced recently, 2006, and the employment opportunity for critical care nurses will be theory in hospitals, educational institutions and community healthcare settings. 1.6.1 Specialization in critical care nursing. So far, the specialization in critical care nursing is not mandatory for a professional nurse to work in critical care units. Nurses by choice or as part of the routine postings are working in critical care units. However, some institutions do prefer to employ nurses who are accredited in critical care, because they have acquired specific higher competence in the specialty and have successfully completed the training program. 1. Educational programs. Critical care knowledge at the application and analysis level require the strengthening of the critical thinking abilities. You will be able to strengthen your skills and abilities about diagnosis of critical health conditions and dealing with these effectively through this course, theory and practical as prescribed. The nurse, RN, RM, need to have minimum 1 year clinical practice before enrolling for post-basic diploma in critical care nursing, PB, DIP, CCN. Longer practice experience in critical area will help nurses to strengthen their clinical care skills. In USA, for the care competence examination, certified critical care nurses are required to have 2 years of practice in critical care as eligibility. They have renewal process every 3 years, which includes undergoing extensive continuing education and clinical experience in critical care. In India, minimum requirement is specified by INC, Indian Nursing Council, and the examining board or university. Critical care nursing programs available in India currently are as follows. Post-Basic Diploma in Critical Care Nursing. M.Sc. Nursing, with Critical Care Specialty 2. Employment opportunities. Availability of accredited critical care nurses are in short supply. In India, there are very few nurses as this program was started in 2006. But there is a high demand of critical care nurses in private as well in governmental sectors for the betterment of expected patient outcome. Figure 1.2. Figure 1.2. Employment opportunities. Look at the screen. The critical care nurses with specialized skills and experience will have better basis for increasing their market value and employment. A study on registered nurse populations in USA revealed that 59% nurses were employed in hospital settings. Thus, the critical care nurses can work wherever the critically ill patients are found as discussed above.
1st June 2002 Future Prospects of Critical Care Nursing. Rapid advances in healthcare technology is considerably facilitating the movement of critically ill patients from ICUs, CCUs to intermediate care and or to home as soon as critical conditions is stabilized, which was not possible about a decade or so. You know that package deals for many of the surgical medical interventions, e.g., coronary artery bypass graft, CABG, angiography, etc., are in practice. However, this is also true that patients in critical care are more ill than ever in other areas. Many of them would not have survived if they did not get competent, dedicated care in a well-equipped critical care unit for the purpose. Technological advancement in diagnostic procedures and treatment therapies have increased patient survival rate, prevented disability, and the occurrence and intensity of the acute or critical illness. More and more nurses with necessary expertise will be required not only to manage critical care hospital services but also to manage them at home through preventive and rehabilitative care in community health setting, home care and OPD care. The critical care nurses will be required as administrators, managers, clinicians, direct care providers and educators. To face the innumerable challenges, the critical care nurses must keep pace with emerging new and updated knowledge about critical sickness and its care. They must develop skills to manage, administer new treatment strategies, operate equipments, gadgets, machines safely, and work as an effective member of the critical care team. It can be said that critical care nursing is an emerging specialty within nursing, and it has promising future prospects for an ongoing higher professional development and employment. 1.7 Role of a critical care nurse. A critical care nurse performs many roles and responsibilities while working in critical areas. To share these effectively, the nurse need to develop certain qualities and competencies. 1st July 2001 Traits of a critical care nurse. Traits are the qualities which you as critical care nurse need to develop for an effective and collaborative functioning. These precisely are given below. Times accreditation, successfully gone through a accredited program and is qualified to render competent critical care to clients. Times personal attributes, pleasant, approachable, courteous and respectful to patient, family, critical care team members and others. Times communication ability, speaks in simple, clear and known language using appropriate gestures while communicating to clients. Listens attentively, articulate thoughts in an intelligent manner, differentiate changes in behavior and uses appropriate channel of communication. Times interpersonal relationship, IPR, develops trusting rapport with clients and others concerned. IPR form the basis for effective interaction and nursing interventions. Times discipline, punctuality and honesty, she should be self-disciplined, punctual and honest in all professional performance and its connected task. Dedication and compassion, dedicated to her work and render care to patient and family not only technically perfect but also with sensitivity and concern. Times credibility, persuasive in motivating clients and others to perform better. Pursue skill improvement and professional advancement. Times coordination and collaboration, encourage cooperation and cohesiveness among team members. Recognize and respect team efforts in client care. 1st July 2002. Competencies and a critical care nurse. The skills of a critical care nurse is required to develop are listed below. These are not new to you, are aware of that and using it in your work areas. Times demonstrates ethical behavior in all professional dealings with clients and others. Times provides culture-sensitive, evidence-based critical care. Times uses nursing process while dealing with the patient's nursing care needs problems. Times monitors continuously patient condition, detect deviations and initiate proper timely action. Times exhibits critical thinking combined with scientific knowledge to make complex decisions about nursing care interventions. Times understands the changes in physiological and psychological behavior of patient and family as consequence of insult or injury critical illness. Times demonstrates safe and skillful handling of life-saving machines, gadgets, equipment used in critical care units, etc. Understands the essentiality of team approach in critical care and to function as an effective team member. Strictly adheres to critical care standards and protocols practiced in critical care units. Initiates development modification of these on the basis of new knowledge that have come through research, etc. Times establishes trusting IPR with patient, family, critical care team and other departments institutions involved in the care necessary for patient recovery and rehabilitation. Times builds therapeutic communication skills through appropriate interaction and the use of relevant information and communication technology. Times participates in advocacy of patient, family and the public concerns for improvement in critical care system and its prevention. Presents publishes papers and showcasing critical care related aspects in conferences, workshop etc. Organized at institution state, national and international levels. Initiates participates in critical care nursing research activities in the critical care areas to improve the nursing care and adds to build a body of nursing knowledge in critical care nursing. Participates at different levels in discussions and contributes towards the development and continued improvement in critical care system and nursing tari structure of the healthcare setting. 1st July 2003, Function and Job Responsibilities of a Critical Care Nurse. The job responsibilities of a critical care nurse are manifold. You may recall your own experience while nursing seriously ill patient in your practice area. Nurses are responsible of the following activities. Times to conduct complex and complete assessment of the patient that includes taking biographical details of the patient and his family information, history of illness present, past illness of the patient and also the family medical history, lifestyle, habits, addiction etc. Conducting thorough physical examination by inspection, palpation, percussion and auscultation to detect level of deviation from normal, sending, receiving and interpreting investigation results and taking appropriate action. Times to perform assessed intelligently in high intensity BTLDPs, interventions, continuous monitoring and documentation of patient's condition. Times to create humane and caring environment for the patient and family keeping in view the physical, psychological, social, spiritual, and safe environment to hasten the healing. Times to render competent and compassionate nursing care based on your knowledge, skill, and experience in critical care using nursing process. Times to document and evaluate the nursing care plan continuously and modify it accordingly. Times to administer nursing and medical therapies timely and appropriately. Times to perform assist in investigative procedures effectively. Times to handle high technology gadgets, machines, equipments used for hemodynamic monitoring, cardiac monitoring, and blood gas analysis, etc. skillfully. Times to be competent and skillful in applying life-saving measures devices, e.g., cardiac compression, mechanical ventilation therapy, use of intra-aortic balloon pump, IBP, ventricular assistive devices, heart-lung machine or extracorporeal membranous oxygen circuits, ECMO. Times to initiate appropriate action in a critical situation of patient care and be accountable for the action. Times to keep patient family informed about patient progress, nursing interventions, medical therapies and their outcome. Times to obtain written informed consent as per hospital policy prior to initiating nursing medical procedure. Times to safeguard and monitor the quality of care the patient family receives. Times to check and ensure functioning of gadget equipments used for patient care. Times to act as liaison between patient family and critical care team. Times to provide psychological support in an eventful situation to patient and family. Times to involve patient family in his her care gradually as conditions stabilize to build self-confidence and taking independent decisions. Times to prepare for discharge patient family by teaching them care aspect, prevention of disabilities, rehabilitation and necessary follow-up in OPD, etc. Times in case of terminal illness, help patient to have dignified peaceful ending of life and support family in accepting the loss, also counseling for organ donation. Detailed explanation of these you will be learning in onward program. Times ensure smooth and efficient running of the critical care unit. 1st July 2004, Roles of the critical care nurses. You know that critical care nurses work in variety of critical care settings and perform many activities. Let us discuss these as follows. 1. Clinician, provide bedside care to assigned patient, S. 2. Nurse practitioner. This is an alternative critical care setting than the hospital where terminally ill patients are cared, e.g., hospices. 3. Advanced nurse practitioner. ANP. These are the nurses who are prepared with MSc master or doctoral level of education in critical care nursing. They mostly function as follows, however, some of these levels are yet to develop in our country. Times clinical nurse specialist functions in critical care unit and is responsible for planning and implementing care for the patient and family, which involve identification, intervention and management of clinical problems. Times acute care nurse practitioner ACNP. In critical care, ACNP focuses on making decisions on patients' complex problems. These involve risk evaluation, interpretation of diagnostic tests, providing treatment which may include prescribing certain medication, etc. 4. Nurse educator. As per nurse's level of preparation in critical care nurse, she functions as teacher in schools and College of Nursing. In clinical area, she is responsible for health teaching to patient family and organizing conducting on-the-job training for clinical nurses, students, and other staff. 5. Nurse manager. Nurse managers function at different level of critical care setting efficiently through proper networking and necessary empowerment as team leader, supervisor and administrator. 8. Networking. For example, building connection with nursing and other departments that encourage sharing of mutual information concern which will have synergic effect. B. Empowerment is a process of enabling others to do for themselves. It helps nurses to grow in profession and their patient family to gain independence in healthcare. You as a manager can do this by using open line of communication built through trusting relationship. Open line communication enhances mutual sharing of information and goal setting, planning care and implementing actions. This encourages decision making and taking responsibilities for actions. 6. Mentor. New and junior staff in critical care unit requires guidance or mentoring to enhance necessary performance skills, communication skills. Criticism should be supportive and constructive that encourages self-confidence and learning. Self-demonstration, clinical teaching and role modeling are some of the tools which could be used for mentoring. 7. Advocacy. This relates to representing others' concerns. Nurses in critical care represent patient and family concern about medical nursing interventions, diagnostic tests, treatment, financial involvement, etc., which need to be taken up with concerned authorities for amicable solution. 8. Counselor and guide to patient and family to accept realities of care outcome to make best possible adjustment to the health outcome. 9. Researcher ensures evidence-based critical care and builds the body of the critical care nursing as disciplined practice. 1.8 Summary. In this unit you have learned about the concepts, principles in general applicable to critical care nursing rendered in healthcare setting. Critical care is a growing specialty within the nursing profession. It has good future prospects as nurse manager, administrator, educator, clinician and researcher. Diploma and degree level education is available in this specialty in the country. As critical care nurses you must keep abreast with the emerging medical and health technology, impacting the care as life-saving, recovery and rehabilitation aspects. Nursing care approach aims at improving the quality of life with whatever limitation the client may present and advocate their concern with appropriate authority on its prevention and the nursing care facilities required for effective and efficient care. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.